In the hospital setting, typically our patients come through the emergency room and we will get information that there is this individual patient that needs to come to our unit. They will come up and we will treat them no different than we do any other trauma. We will treat them no different than any other patient. We will do everything we can to save their life. We will make sure that that family is included in the process, that they are educated along the way. Best circumstances is that as we're starting to see neurologic changes on them, that we have that family right beside us at the bedside and we let them see, look at those pupils. Now, an hour ago when we shine this flashlight in their eyes, we saw a difference. Now we're not seeing that. Before we were seeing a cough, and now we're not seeing that cough anymore. So that they're part of this process and they're seeing the declines. So when it comes to the point of brain death and when we're no longer seeing those reflexes, that it's not a surprise to them. Once we start seeing that that life is not there any longer, then it's still continuing to keep that family a part of the process, involving different types of testing, is more for declaration purposes, more for definitive types of testing, and then again letting the family see that, letting them be a part of that. Of course, once we started to see the decline in the patient, we would contact IOPO. We would have them come in, make sure that they've had a chance to review the chart, make sure that they've had a chance to be part of the process.
So what happens is the hospital will contact our organization and let them know that there's an individual in the ICU that meets the clinical triggers for organ donation. And when that happens, the phone call is taken by our clinical support coordinators that staff a 24-hour, 7 days a week call center. They receive that phone call, they preliminary accept or decline the patient as a potential organ donor. And then what happens is we may send a family services coordinator out to further review the chart, assess the patient, and see where we go from there.
We then are paged by our call center and asked to visit the hospital and visit this patient in particular. Upon arrival, I do a chart review. I will briefly interview the nurse about the neurological status of the patient. And from the chart review and this little interview, I get a drift of whether or not this is going to be somebody that we're going to follow.